Shoulder movement. When assessing movement of the shoulder, we tend to mainly think about the glenohumeral joint. Although the glenohumeral joint has a large ball and a relatively shallow socket, the acromion does limit its movement so that it only has 120 degrees of abduction and 120 degrees of forward flexion. However, there's 90 degrees of internal and external rotation at the glenohumeral joint. This animation demonstrates the 120 degrees of glenohumeral abduction and the 90 degrees of internal and external rotation. However, we know that the shoulder can abduct to 180 degrees in full elevation. The first 120 degrees of this is obtained by glenohumeral abduction, and the next 60 degrees is obtained by tilting and rotating the scapula upwards. This is achieved by a complex arrangement of movements between the sternoclavicular joint, the clavicle, the acromiclavicular joint and the scapula. This is known as the Scapulo-Thoracic joint. It is not a true joint, but it's really the movement represented by the scapula moving over the posterior chest wall. So to truly assess shoulder movement, we have to look at the whole of the shoulder girdle, from the sternoclavicular joint, clavicle, acromiclavicular joint and glenohumeral joint to the scapula itself and the Scapulo-Thoracic joint. We can break the movements of the Scapulo-Thoracic joint into its component parts. The sternoclavicular joint has 45 degrees of elevation and 5 degrees of depression in the anterior plane. The AC joint allows 5 degrees of elevation and depression. On this animation we can see movement at these joints allows the clavicle to tilt up, rotating the scapula superiorly. The sternoclavicular joint also allows 35 degrees of protraction and retraction. Protraction of the scapula on this animation allows it to move forwards and to slightly tilt further upwards. There is 40 degrees of anterior and posterior rotation at the sternoclavicular joint and 5 degrees at the AC joint. Posterior rotation of the clavicle further elevates the scapula and tilts it upwards, achieving full elevation at the glenohumeral joint. In the full animation we can see abduction of the glenohumeral joint, elevation of the clavicle, protraction of the scapula and rotation of the clavicle backwards, achieving full elevation. So far we've described the full shoulder movement as that at the glenohumeral joint and the components at the Scapulo-Thoracic joint. However, in real life this is not a linear arrangement. In fact, it's a synchronous arrangement where both the glenohumeral joint and Scapulo-Thoracic joint are moving together. As a general rule, the first 30 degrees of abduction is purely at the glenohumeral joint, then the next 150 degrees is a combination of both the glenohumeral joint and the Scapulo-Thoracic joint, sometimes known as Scapulo-Humeral Movement or Scapulo-Humeral Rhythm. This tends to be in a ratio of 2 to 1, but can vary greatly between patients. Some of the key muscles have been added into this animation, and we can see that both the glenohumeral joint and Scapulo-Thoracic joint are moving together. As we can see, the first 30 degrees of abduction is mainly done at the glenohumeral joint, then the rest of the movement is a composite of both glenohumeral and Scapulo-Thoracic movement together. In summary, full movement at the shoulder is made up of components from the glenohumeral joint and the Scapulo-Thoracic joint. They work in a coordinated sequence, which is sometimes known as the Scapulo-Humeral Rhythm. There is normally a ratio of 2 to 1 between glenohumeral and Scapulo-Thoracic joint movements, which is non-linear. However, there tends to be a great variation between different people. Any problem with the sternoclavicular joint, clavicle, AC joint, glenohumeral joint or scapula can have an effect on shoulder movement. An early manifestation of any of these problems can be a disturbance in the Scapulo-Humeral rhythm. To assess this, it's important to compare sides on a patient. If you'd like to see more videos on rotator cuff repairs or any other aspects of shoulder surgery, visit my YouTube channel Cambridge Shoulder or my website cambridgeshoulder.co.uk.